Hi, this is John Hellerstedt. Can anybody hear me? This is John Hellerstedt. Can anyone hear me?
Hey, Dr. Hellerstedt. Yes, sir, we can hear you.
All right, hello everyone. Thank you for joining Congressman Roger Williams and DSHS Commissioner Dr. John Hellerstedt today on this virtual town hall. In order to ensure a fluid and productive discussion, we've received some pre-submitted questions that will be asked throughout the call. If you would like to ask the Congressman or Commissioner Hellerstedt a question during the call, please submit it in the Q&A box at the bottom of your screen if you are on a computer. Please write your name and then your question, and it will be submitted into the queue. If we are unable to get to your question due to time, please visit the Congressman's website at williams.house.gov or call the Austin office at 512-473-8910. With that, Congressman Williams, would you like to open our discussion with a few words?
Thank you, Heather. And I am Congressman Roger Williams, and I'm honored to be your representative in Congress. And I want to thank everyone for taking the time to listen in this afternoon and join another discussion on the state and federal response to the coronavirus. I especially want to thank my friend, Dr. John Hellerstedt, for being with us again today. Dr. Hellerstedt is the commissioner, as you know, of the Texas Department of State Health Services, and I'm grateful that he's taken the time to provide us with his insight and knowledge. So diving right in here, there is no getting past the fact that we are living through unique circumstances and uncertain times. To give a little bit of background, the United States health officials found about the virus on the last day of December 2019, which originated sometime in November in China. We've come to understand that the virus spreads easily, and in order to prevent further spread, we've all got to do our part. And over the last few months, I've received a lot of questions about what Congress is doing to respond. And I want to give you a brief update about my work on your behalf. At the beginning of March, we passed an $8.3 billion emergency funding bill that provided funding to address the virus here at home and abroad. This included funds for vaccine development, purchasing essential equipment and supplies, and assisting state and local health departments. We then passed the CARES Act that included relief for almost every business in the country in the form of financial assistance through government grants, low interest loans, or tax relief. Because of its passage, I'm proud to have delivered $21 million in funding over the last few months to the 25th District for critical infrastructure improvements, rural health care, testing, and education. In order to provide an emergency lifeline to small businesses in the bill, we created the Paycheck Protection Program. The PPP, as it's known, has been overwhelmingly successful, and to date, in the 25th District, it has given nearly 6,000 Texans small business loans, preserving over 58,000 jobs in our communities. There is still about $130 billion left in the program, and if you are a small business owner who has yet to apply, I encourage you to do so and to reach out to my office so we can assist you. To provide additional funding for the Paycheck Protection Program and increase resources for healthcare professionals and testing, Congress passed the Paycheck Protection Program and Healthcare Enhancement Act in April. I also was proud to join my colleagues calling for our rural health clinics and rural hospitals to receive funding available to small business under the CARES Act. It is of the utmost importance that these providers receive the support necessary to combat the toll of the virus and continue serving Texans. Your safety and your health will always be my top priority, and I've been working with the Trump administration to use every resource at our disposal to keep the 25th District healthy. I encourage everyone to visit my website at williams.house.gov/coronavirus for more information on resources for small businesses and assistance for the 25th District. You can also call my Cleburne office at 817-774-2575 or my Austin office at 512-473-8910 with any questions you may have. I want to take a moment to thank any healthcare professionals or first responders here with us today. We know you're on the front lines of this response, and we are very grateful for your dedication and commitment to helping our families and our neighbors. Thank you, thank you, thank you. And thank you again to Dr. Hellerstedt for joining us today and to all of you for participating. So with that, Doctor, would you like to share a few words?
Yes, Congressman, thank you very much. And I really appreciate the opportunity to speak to your constituents. As you said, we live in very uncertain times. If there's anything that's certain about it, it's the fact that COVID-19 is in our communities. We have really widespread community transmission of COVID pretty much everywhere in the state, since it's a virus that is spread by respiratory droplets from person to person. We find the most concentrations of it where we find the most concentrations of people. So those are our big cities, primarily our urban metro areas, which of course Texas is very vibrant. And so it's not just the cities themselves, but the surrounding counties that are all a part of the growth in Texas. And pretty much all of those metro areas, including their contiguous counties, are seeing upswings. Naturally, though, the governor recently strengthened, if you will, the requirement to wear a mask when possible and in public when it's not possible to get out of 6 feet of distance from another person. And that was back on July the 3rd. I hope that we're beginning to see some of the very beginnings of not a downturn, but rather a slowing of the acceleration of the disease in our state. Naturally, the thing that we want to do most is protect the ability of our healthcare system to care for individuals who get sick. And so we're very much keeping an eye on how many patients are in the hospital, how many patients are in ICUs. Naturally, we're a very big state, and so we look across the entire state and look at things at the level of what we call our trauma service areas. So those are areas of the state where there's really kind of an organized system of based primarily on trauma care, but it has the cooperation of all the hospitals and all the ambulance providers who are in those communities. And we get a lot of our information and data about the state in the hospitals based on that. So we know that there are some areas of particular stress. For instance, the lower Rio Grande Valley is one. The Austin area is one. Houston as well, and then out in El Paso. We are recruiting staff for those, so we have had a robust system of having contracts in place prior to COVID-19 that we use in the case of other types of emergencies, hurricanes and wildfires and the like, where we can call upon our contractor to send in doctors, nurses. In this case, it's doctors, nurses, respiratory therapists, pharmacists, really to help supplement the staff that are in the hospitals. So normally a hospital will be running with a certain number of its beds that are not full, not taken up. Usually they're not at 100%. And in most cases, a lot of their care that they provide is for non-emergency types of things, certain types of procedures that I wouldn't call them elective. I would just sort of call them not emergency care. So one of the things that the governor, again, has done is that in those larger urban areas, in those larger trauma service areas now, we've asked that those hospitals not perform those non-emergency type services so that more of the bed space is available for people who have COVID-19 and are sick enough that they can't take care of themselves at home, that they do need to be in the hospital, and in some cases, they need to be in an intensive care unit in the hospital. So again, we're watching that very carefully. We're providing staff. That's the staffing is the number one request from the hospitals right now to be able to expand the number of covered beds, occupied beds, and be able to provide appropriate care. And as you may know, there are other states in the union that are experiencing surges in COVID-19, very large populous states such as California, Florida, our neighbors, really along the Sun Belt are seeing something of a rise. So we have to be aware that we're part of a regional trend, a very large region, very populous region that is asking for more and more of these precious medical personnel. In addition, we are providing, all along we have been providing things like personal protective equipment of a medical grade that can be used in the hospital. We have so-called PPE that can be used for other purposes outside of the hospital. One of the other things we're getting is oxygen canisters that can be used in ambulances, as well as what are known as oxygen concentrators, so that someone who is convalescing from their COVID-19 might be able to get discharged home, but have an oxygen concentrator to go home with for the next several days while they recover. So our activities really are most intense around, again, finding that extra staffing. The federal government's being very helpful. They are sending us a number of teams. We're actually sitting down today and making sure that we have an inventory of all the various federal teams and assets, where they're going, what their mission is, and then combine that and compare that with the private contractor assets that we have to ensure that Texas will have all of the medical staff and medical personnel that it needs to meet the challenge. Another thing that I'll mention is a drug, an antiviral drug called remdesivir, and that has been being distributed again, starting with the federal government. The original allocation was essentially a donation by the drug manufacturer Gilead, and those were shipped to the various state and territorial health departments, including Texas, and then we shipped them out to hospitals based on the number of COVID-19 patients. that they were taking care of. Now there's a slightly different paradigm. In this last week, we just did the first version of that, where we at the state health department, we designate the hospitals, but then the shipping takes place, the actual delivery of the medicine takes place at a national level with a national distributor. So again, to summarize, we're watching the trends very carefully. I think the thing to keep in mind, for folks to keep in mind, is that we really are trying to strike a balance. We're trying to strike a balance where we diminish the rate at which COVID-19 comes through our communities, at the same time allowing for maximum ability to conduct business, and thereby, that's how we create the goods and services that we all need in daily life. That's how people go to work and earn money and feed their families and pay their bills. So we can't go too far in the direction of shutting down the economy for too long, or we pay a very terrible price that way as well. That's where the things that we've asked people to do come in to play, and we really need people to understand the role that they play, that their individual behavior plays in cutting down the spread of COVID-19. So number one, if you can stay home, stay home. I think that's particularly welcome or good advice, rather, for folks who are over 65 or who are over 65, and particularly if they have underlying serious medical conditions, or really anybody of any age with serious underlying medical conditions is statistically far more likely to have a very serious battle with COVID-19, and so in some cases, loss of life. So stay at home, wear a mask if you're in a situation where you can't be more than 6 feet away from somebody, especially if you're indoors. We really ask that people wear cloth face coverings. And why is that? Well, it's because the germ is spread through droplets. It's a virus. It may be a new virus, but it's a virus nonetheless. And we know how to control those respiratory viruses. And so simply by having a cloth face covering, something that is blocking the droplets that all of us produce, whether we're just breathing or talking or singing or shouting or however the case may be, those respiratory droplets are going to come out. That's where the germ is. By having a cloth face covering or a non-medical grade mask, you're going to catch those germs, those viruses, before they infect someone else, either directly or get on a surface and get traded that way. Naturally, also, the hand washing is something very important, and then cleaning and disinfecting surfaces that you touch in common with other people. And those are really the fundamentals. And you may ask, well, is that really going to work? And the answer is absolutely yes. Think about it. We have lots and lots of our healthcare folks, professionals who are out there taking care of known COVID positive patients in hospitals and in intensive care units and in nursing homes, but they're wearing their PPE. Now they get medical grade PPE. They get training on how to use it. So that's an optimal situation. But it's very clear that it is preventing them from getting the infection. Not perfectly, we wish it was, but by and large, those folks, if they take those precautions, use the personal protective equipment, the masks in particular, they are preventing themselves from getting COVID-19. So that's really, when we talk about face coverings for the general public, that's what we're trying to do. We're trying to extend that same known effective measure to everyone, because right now, one of the things that we've discovered about COVID-19 that we did not know in the beginning is that people with very few or even no symptoms play a significant role in spreading COVID-19 around. So people may unknowingly be infected with COVID-19. They feel fine, but they're actually spreading the virus. And so that's why I think one of the best ways to sum it up is when my wearing a mask protects you, and you wearing a mask protects me. And so that's a very important message. I know we want to all be good neighbors, good Texans, and we want to help ourselves get over this very difficult period. So I'll stop there.
Thank you, Doctor. That's a great, very insightful report. We appreciate it very much, and for the job that you're doing. Heather, you want to get us started?
All right, thank you, Congressman. Again, if you would like to ask Congressman Williams or Dr. Hellerstedt a question during the call, you can use the Q&A chat box at the bottom of your screen, and your question will be visible for participants when answered. We'll go ahead and begin with our first pre-submitted question from Charles, which says, small businesses are suffering. Do you expect additional payroll assistance to small businesses?
Well, Charles, that's a great question. And we know that the PPP program is working, did work. There's still $130 billion left in the second phase that's available for those that did not apply as of yet. So that's important. But and any other stimulus package, I think we need to go through the $130 billion and see what would be next. But the program has worked, and it'll continue to work in putting people back to work, opening jobs up, and getting Main Street America back on track, because that is the strength of our economy, is Main Street America. So I would say if you or any of your cohorts need assistance in probably applying for the $130 billion, let my office know, and you can go through my website at williams.house.gov, and we'll help answer any questions you may have or someone you know may have about getting involved in that program.
All right, thank you, Congressman. The next question is from Steve, and it's for Dr. Hellerstedt. Steve asks, what day did DSHS first receive new case counts that included results from antibody tests added to results from viral tests?
I'd have to go back and look at the data. It's been for the last couple of months that we've gotten those as separate reports. If you want to wait just a second, I can pull that up.
All right, we'll go ahead and move on to a next question. Our next one is from Monica for Congressman Williams. Monica asks, is Congress going to pass another stimulus package?
Well, we kind of touched on that just a minute, Monica. We have still $130 billion in the PPP program that's out there. I think we need to continue to look at how this current package has worked. I think we need to do everything we can to provide immediate relief to the economy, which I think has been happening. And one of my top priorities as a small business owner in Congress is addressing our spending issue in D.C. So we need to proceed carefully with that. I think we need to let Main Street America cash flow our country, and we've got to get serious in Washington about watching expenses, and we've got to begin to do that and so forth. But the biggest thing that I think, too, we need to do is we have to protect our small business and big business owners from liability protections through this thing. A lot of businesses are very nervous to open up because they feel they have liability if someone may come up with the virus and they didn't know, or they might get accused of allowing it to happen in their business. And that's dangerous because that brings the trial lawyers in, and the trial lawyers can put you out of business, sue you out of business, and then we're back to square one again. So as Mitch McConnell has talked about, as he's called it, liability is a red line issue for any future bill. I agree with him totally. And we'll be working on that when we get back. But let's use up the $130 billion and then go from there. And we may want to go back to the doctor, Heather, if he's got his answer to that last question.
Yes, I do. Thank you, Congressman. May 9th was the first time we recorded the antibody test separate from the totals.
All right, thank you, Dr. Hellerstedt. The next question is from Natalie for Dr. Hellerstedt. She says, I saw a news story this weekend mentioning a Midland, Texas doctor named Dr. Richard Bartlett, who is researching inhaled steroids as a treatment for COVID. The story said NIH was researching, as well as Oxford University, Spain, and France. And Taiwan and Japan were already using the treatment. I'm curious if the state of Texas was researching it and your thoughts on the possible benefits.
Well, typically, the public health system in Texas would not be engaged in that kind of research. That would be the sort of thing that hospitals, doctors, and universities in particular would be engaged in. I really welcome the notion that there's active research going on. Again, this is an inhaled steroid that is used in the treatment of asthma, and it would be great to find something that would be that available and that simple and to have proven benefit. So one of the things that we strive for in the United States, in particular across all of medicine, including public health, is for our recommendations to be evidence-based. So we want to make sure that when we say something has benefit, that there's data to back that up. So again, we're all very anxious to see what the data shows in terms of this research. If it works, it will be a great step forward.
All right. Thank you, Doctor. Our next question is from Michael for Congressman Williams. And Michael asks, what have you done to help rural hospitals in our area? And will they be receiving more funding?
Well, that's a great question and an important question. I'm very proud to have been a strong advocate for our rural healthcare providers. And, you know, in our district, we have many, many rural healthcare hospitals and providers. And when they're affected negatively, it does affect the community. And we've been working with all of them. And I've partnered with the Trump administration, local officials, and have been able to deliver hundreds of millions of dollars to rural hospitals for testing and equipment. And the testing is so, so important. And these facilities are crucial to our communities, as I said, and they provide life-saving care to our fellow Texans. And I'm going to continue to fight on their behalf and stay in communication with local health officials to make sure they have the resources to serve patients. And I will tell you, for those of you listening, there is no shortage of conversation from the local health officials when they talk to me or my office about needs. They do a great job. And if you just saw, HHS just announced $410 million in additional funding for rural facilities from the CARES Act and $3.5 million stimulus bill. So money is still being given out to our rural carriers, and that's so important, especially to our district.
All right. Thank you, Congressman. Our next question is from David for Dr. Hellerstedt. David says, I've seen mixed reports about Texas hospitals reaching capacity with hospital beds. Is that true? And what's being done to make sure they don't get overwhelmed?
That's a great question. As of right now, they are not full. They still have some capacity. And we kind of have a three-phase way in which we want to increase the capacity. And the first three of those phases are what I would term intramural. And by that, I mean within the walls of the hospital. So as I explained earlier, in some cases you postpone the types of treatments and surgery and things like that can be postponed. In other words, they're not urgent, they're not emergent. The patient is not going to be harmed by waiting a few days or weeks even for that surgery to take place. That typically is a fairly sizable percentage, a fairly sizable proportion of what most hospitals are providing during the day. So simply by going to only emergency or essential type services, that frees up a lot of beds. When you free up those beds, though, what you've got to do is provide doctors and nurses and staff and pharmacists to do it. And so that's where our contractors come in. That's where the federal government is also helping us with sometimes branches of the military that can step in and help provide that care. Again, doctors and nurses and pharmacists from those uniformed services. As you may imagine, before being the Commissioner of Health, I was a physician executive in a hospital system here in Austin, and so I saw very clearly how it is that a hospital isn't just rooms with patients and doctors. A hospital is a very high functioning organization. And so having the pharmacy to do the right things, having housekeeping that can keep the rooms clean and make room for the next person when someone gets better and gets discharged, you have to really do a very thorough cleaning of that room. And that requires people with training and skill. So hospitals themselves aren't, again, just rooms with doctors and nurses. they're really well organized ways of taking care of people. And that's why the emphasis through the first 3 of the 5 phases that we have is about expanding the ability to take care of patients inside those hospitals. And that's primarily opening up, beds in the way I described, sometimes even opening other areas of the hospital, like an operating room, for example, or a recovery room, and using that for acute patient care. Then the next phase is outside of the walls of the hospital would be to look for things like ambulatory surgery centers or things of that nature that could be converted to hospital care. And then the last phase would be to create something like a field hospital if it was necessary. But we're not anywhere near that last phase at all. In fact, we haven't really maximized the first 3 phases of that hospital care. And that's why we are working very intently, literally around the clock, identifying the needs, the staffing needs, the equipment needs, ventilators, oxygen concentrators, high flow oxygen equipment and meters, all in an effort to help folks. And then I also mentioned remdesivir, which is the antiviral drug that has been shown to often hasten the recovery of hospitalized patients with COVID-19. And the more you can hasten that recovery, if, like, say somebody was going to stay 8 days and you were able to get them out 2 days sooner, you've actually increased the number of hospital beds in a way by 25%. Another thing that we are doing is looking for what we call step-down care. So in other words, a patient's stable, they may still need oxygen, they may still need someone to provide them with food and support, but if that can be done in an outside environment, either at home or say in a hotel that we've contracted with and staffed, and have our oxygen concentrators there. So that's the step down unit. So having somewhere for the hospitals to discharge a patient in a situation like this that's safe and supportive is another way to increase hospital capacity. So we really are trying to leave no stone unturned at all in order to maintain that hospital capacity, because we know it's extremely important.
All right, thank you, Dr. Hellerstedt. We'll go ahead and launch our first poll question now. It will pop on your screen and remain open for the duration of the call. All right, we'll go ahead and move to our next question from Lynn. Lynn says, is there still money left in the Paycheck Protection Program, and can businesses still apply?
Yes, there is, Lynn. And as we said earlier, we want businesses to apply. That program ended the end of June, I'm sorry, and we've extended it in Congress. We voted the other day to extend it through August 8th so everyone can have access to the remaining $138 billion. So yes, it is still open. And as I said earlier, anybody that wants to help us take them through the process or whatever, they can go to our website, williams.house.gov. We can assist them in applying.
All right, thank you, Congressman. Our next question comes from Lori, and Lori asks, what are you doing to keep voting safe in November?
Well, that's a great question. It's sure one that's been in the news a lot. And I think, Lori, you're probably thinking about ballot integrity, I would call it. But, the most important thing we have as Americans and Texans is to vote, the most precious right there is. And we need to keep the vote safe, secure, and make sure it gets counted. So that's one of my top priorities. And being former Secretary of State, I dealt with this a lot. So it's kind of close to my heart that we get it right. There's a lot of conversation, and it's really it's bipartisan consensus that mail-in ballots, they've been talked a lot about recently. They're the finest form of voting, allowing voter fraud there is. I can tell you that. So we got to be very careful, and those people that do mail a ballot in, we got to make sure it is done properly. And of course, when you fine tune it, voting is a function of the state of Texas, not the federal government. But it's important that every vote gets counted. Everybody has a chance to vote. Everybody participates, because this is what makes our country great. I mean, this is one of the reasons people come, is because we do have secret ballot, and we vote for our leaders, and we have smooth transitions when after the election. So we're doing everything we can to make sure your vote counts and there's no cheating going on.
All right, thank you, Congressman. Our next question comes from Ashley, and she asks, what do you think about schools reopening? I have 2 elementary-aged kids, and I'm still working from home right now, but I'll need to return to work in the next few months. I want to make sure they're safe, but I also won't be able to stay home all day in the future.
Well, actually, that's a question we're hearing a lot from a lot of people, even my children. We need to get our kids back in school. We lost, I think, March, April, May, when schools shut down, we lost 3 months of educating our kids. Very important period of time. We've got to get them back in school. We've got to do it right. We've got to make sure of our safety for our teachers and our children, and do it responsible. But even the CDC and American Academy of Pediatrics have publicly advocated for reopening schools, because they say it's crucial, as they say, to the development of the students. And I certainly agree. We got to get back to normal. We got to get back to going to our meetings. We got to get back to sports. Parents got to get back to their jobs. Students just have to have access to learning materials in the classroom. But they also, when they do that, when they're back in school, they develop social skills, which, how important is that right now? So we're not going to be able to get our country back on track to what I would call normal until we have our children in school safely and our teachers in school teaching safely.
Congressman, this is Dr. Hellerstedt. I just want to chime in and say I agree completely. I'm a father, a grandfather, and a board-certified pediatrician. I was very pleased to see the American Academy of Pediatrics come out in favor of starting school. But as you say, the bottom line is safety. And we can work with the schools here in Texas, with the Texas Education Administration, and really suggest ways to keep the environment as safe as possible and cut down on COVID-19. But yes, learning is a crucial part of childhood development, and along with the other things that you talked about, the physical development of the sports, the social development, and so it is a top priority, I know, for us at the state to ensure that we find ways and create protocols and guidelines that can allow the schools to open safely and resume in-person instruction.
Thank you, Doctor. That's great.
All right, thank you. Our next question from Natalie is for Dr. Hellerstedt, and she asks, why does the virus affect people differently?
Boy, I wish I could write that one up. I'd get the Nobel Prize in medicine. I think that's an excellent question. We don't really know all the answers to it. I guess the best way to say it is that's pretty much true of any germ, of any virus in particular. It's going to affect different people differently. Certainly one of the most crucial things here that we've learned in COVID-19 is that it is more likely statistically to affect a person more adversely the older they are. So beginning of around age 60 and going upwards from there, that's a much higher risk area. Also, as you might imagine, as we all get older, and I'm in one of those age groups, as we all get older, we tend to accumulate medical conditions that are with us then for the rest of our lives. And having underlying medical conditions is also a risk factor. And again, that applies not just to COVID-19, but pretty much to any kind of viral infection in particular. And then again, there's also just the fact that as individuals, our biology is different. Our ability to fight infection is different. And so in any given virus, the way that an individual, let's say if you had a group of 100 20-year-olds, you're going to get 100 different reactions. They're not all going to be exactly the same. They may look very similar, but you're going to get a proportion of them that have no symptoms at all and are just fine, and then you're going to get a proportion of them who get sick. I think that it's wise to keep in mind that just because statistically the younger people tend to do better, it's not impossible that a younger person could have a very serious bout with COVID-19. And I've certainly heard some individual testimonials, if you will, people in their 20s and 30s recounting the fact that they got very sick with COVID-19 and they were in the hospital, and it was a very unpleasant experience to be that ill for a period of time, and it took them weeks in some cases to fully recover.
All right, thank you, Dr. Hellerstedt. We'll go ahead and begin our second poll now. It will appear on your screen and stay open for the duration of the call. And again, if you'd like to ask the Congressman or Dr. Hellerstedt a question, you can use the Q&A box at the lower middle part of your screen. All right, our next question is from Matthew, again for Dr. Hellerstedt. Matthew asks, if I've had the virus, can I get it again?
That is one of the most pressing questions in medical science today. The answer is more likely than not, there is some immunity conferred by having the virus and then recovering from it. But there are also some indications that in certain folks, that immunity doesn't last a lifetime, for example. It may last a few months. But this is an area of very intense active research. I think that if a second infection with COVID were common, we would definitely see that. And so we don't see that it's commonly occurring, but it can occur uncommonly. I think that's an open question. So people are studying that very carefully. When we get an infection, our immune system tends to react in two different ways. One is to produce antibodies, and the antibodies can provide some level of protection. But in some cases, a given virus, the antibodies may fade away after a period of time. The other way we fight infection is through the white cells, the immune cells that we have in our system, and they can form a certain memory, as it's called, of a virus, and there does seem to be an effect of the COVID-19 virus causing the white cells in the body to have an immune memory. So that's good. That should help contribute to a longer lasting kind of immunity. But it's a great question. Again, I think that if it was common for people to become reinfected, we would have seen that. So we don't think it's common. But is it possible? We're looking for the answer for that.
All right, thank you very much, Doctor. Again, if you'd like to ask the Congressman or Dr. Hellerstedt a question, you can use the Q&A box at the bottom of your screen. Our next question is pre-submitted from Paul, and Paul asks, what is your position on balancing safety for all of us and the desire to reopen the economy?
Hi, is that for me?
I will turn that over to Congressman Williams.
Okay, all right, got you. That's a good question, and I think that the safety and health of Texans will always be my top priority. I know it is with the governor. I know it is with the doctor. And we need to make sure our hospitals can handle an influx of cases. I think they've grown into that, and they are better prepared than they were. And I'm working with President Trump to reopen the American economy, as we've talked about, as quick as we can while defeating the virus. I think closing down the economy is not the answer, and we've talked a little bit about that. But that's the main thing. But the safety and health of Texans is going to be on everybody's mind. What's the right thing for each individual and so forth to decide how we move forward? And that's the first question I ask myself every day when I deal with this. So maybe the doctor's wants to just respond to that too.
Yeah, I agree completely. And one of the things that I firmly believe in is that if free people are given the truth, they will make wise decisions. And that is exactly what your leadership is trying to do, your Congressman Williamson, the Governor Abbott, and every elected official I know. the thing they care about most is the people that they represent, and they want the very best for them. So they insist that we are as forthright as possible. We give people true information and true recommendations, and we have faith that they will make wise decisions. I think this is really a test of that. That's why we're asking people to take those precautions that I mentioned, and in particular wearing the cloth face coverings. It literally just keeps you out of range of that virus, and my mask protects you, and your mask protects me. And I hope that we can all see the wisdom of doing that kindness, if you will, for each other, and having that sense of courtesy and sense of caring for one another. It's really something that I think we are capable of, and that as a free people we must do.
All right, thank you, Doctor. Our next question is from Eva. Eva asks Dr. Hellerstedt, how are hospitals getting PPE, ventilators, testing kits, and drugs to meet the needs of the pandemic?
That's being organized at a state level, particularly through our partners. The Department of State Health Services, which is my agency, was designated as the lead agency by the governor in this response. But we're working in addition with the Texas Department of Emergency Management, or TDEM. And TDEM is the amazing statewide organization that you may have heard of in other contexts, such as Hurricane Harvey or wildfires, or particularly other kinds of natural disasters. They're right there. They're the folks that have, again, the ability to move large quantities of goods and personnel around the state to match up with the demand. And so they have been a big part of providing the very things that you mentioned in terms of personal protective equipment at all levels. So they are providing it at the hospital grade. They're providing it at non-medical grade for use in other circumstances. They are going to help provide an enormous number of masks, for instance, for schools for when they're ready to reopen. And so, again, I have to credit my partners at the Texas Department of Emergency Management, and their boss is NIMKID.
All right, thank you, Doctor. We have one more question for Dr. Hellerstedt from Sandra. Sandra says, how many days does it take to get a test? And also, is it safe to donate blood?
It is absolutely safe to donate blood, and particularly of people who have recovered from COVID-19, they're really asking them to seriously consider donating their sera, because their sera has the antibodies for fighting COVID-19, and that may be useful in treating patients who have fallen ill with it. So yes, it's safe to donate blood, no doubt about that. And as far as a test, it kind of depends. Some laboratories are backed up, and it's taking a week or more for the results to come back. And others, I'm proud to say, in our public health system, really our turnaround time tends to be no more than about 72 hours from the time that the test is obtained.
All right, thank you very much. And that's all the time we have for today. We want to thank you for participating in this live virtual town hall with Congressman Williams and Commissioner Hellerstedt. Dr. Hellerstedt, do you have any words you'd like to share in closing?
No, just God bless Texas, and let's all do our part to get through this successfully.
Thank you. And Congressman Williams, would you like to share a few words before we end our time?
Well, I just want to thank Dr. Hellerstedt, again, my friend and Texas's friend, for being on with us today. I appreciate everybody else that got on and to get in the dialogue. We will do more of this. Unfortunately, there is not a book written on how to attack coronavirus. We are writing the book as we speak, but I think we're doing the best job that we can under the conditions that we find them. The leadership from Governor Abbott and everybody else. We are right there with them, and we want to protect our District 25. And any question or any thought anybody has, please get a hold of our office. So thanks again for being on. It's an honor to serve the United States Congress, and God bless everyone.
Thank you, Congressman. Again, if we were unable to get to your question today, or if you'd like more information, please visit the Congressman's website at williams.house.gov or call our Austin office at 512-473-8910. Thank you all. Please stay healthy and have a great rest of your day.